So there are 6 steps to assessing your agency's potential to serve people who have co-occurring disorder. One would be to describe the profile of your current clients. I mean, how many do you think you serve that have co-occurring disorder, and what types of challenges do they face? What are some of the potential changes that you would anticipate in your organization in order to meet those challenges? So estimate the prevalence of the persons served. Chapter 4 actually has some screening tools in it. We'll talk a little bit more about that in the next module. What are the demographics of people that you serve that have co-occurring disorders? What types of problems do they have? Are there clients with co-occurring disorders who seek care at the agency who are referred somewhere else? And what is the profile of those people? Identify the services needed by clients. This is number 2. What services are needed by your existing versus your potential clients? Number 3 is assess your resources. What resources as an organization do you have to meet these individuals' needs? What services are immediately available? What services could be added? What services are available in the community that you could work together jointly to enhance care? And how well are outside meetings, how outside agencies meeting their needs? Are there significant gaps in your community that you might be able to bring up and address that will help ensure the success of your programming? Number 4 is assess your resource gaps. What resources are needed to enhance treatment for people who have co-occurring disorders? What can your agency specifically do to enhance its capacity to serve them? It always kind of comes down to money, doesn't it? I mean, there's always this sense of financially, how do you support change and how do you support your services? Number 5 for assessing your agency's potential is assess your capacity. So take a good close look at the capacity of your agency and ask yourself, what is your capacity to meet these resource gaps? Develop a plan, which is the last step, to enhance capacity. How can the skills of your current staff be increased? What additional expertise can you access through consulting agreements or similar arrangements? What additional programs or services can be offered? And what type of funding do you need to support efforts to enhance capacity? It's really important when you look at changing or improving your programs that you look not just at the program itself, like it's not about a program description, it's about the staff competencies that will be working in the program, the supervision that's available to them, and how do you maintain any changes that you implement. The field that we work in can be really difficult and really tiring, so implementing a change and sustaining it can be very difficult. So making sure that you have leadership support, supervisory support, and clinical competencies, as well as the programmatic changes, is very key. So how do you finance a comprehensive system of care for people with co-occurring disorders? So some of the things you want to consider are, we just alluded to this, provide leadership and build consensus, identify resources, develop new models, and train staff. What we haven't talked about much but is incredibly important is how do you decide on the outcomes? How do you know that what you're doing is successful? And how do you evaluate the program over time? Financing principles. Often when you look at the literature, the most successful programs have a blended funding type model. So you see systems working together, like they have some great programs that are going on in jails where the county pays a portion, the CMH provides a staff, and they kind of work together to ensure that they're both supporting that service. You can do the same type of thing with community mental health and substance abuse treatment, and how do you work together to ensure that if it's a shared population that you're both contributing and helping. One organization I worked for, we had some co-occurring programs where it was just as simple as the substance abuse provider provided a staff, and the CMH system provided a staff, and together they developed this programming and provided some additional services that had the expertise it needed. So it doesn't have to be a check or anything like that. It can be creative and find ways in which you're both contributing. Also, defining the population can be important, securing financing, purchase effective services, purchase performance, and evaluate and improve. It would be very important to understand what the eligibility requirements are for services in the state, for what are the service requirements for that particular service, what are the medical necessity criteria for someone to receive those services. That way, as a provider, you can anticipate what you can expect for financing for that type of model. Essential attitudes and values for clinicians who work with clients who have co-occurring disorders. It's not easy to work with someone who has co-occurring disorders. As we've touched on, they can have numerous struggles and challenges that they're facing. So first and foremost, it has to be someone who wants to work with this population and appreciates the complexity of co-occurring disorders, is open to learning new information, has an awareness of people's reactions and feelings. So this person tends to be pretty in tune with people in general, recognizes their own limitations in knowledge and expertise, and is willing to expand and develop professionally, and recognition of the value of the client input into treatment goals and receptivity to client feedback. Also, patience, perseverance, and therapeutic optimism. I can't emphasize this enough. It is likely that several individuals who come in will be relatively hopeless, and they can, on a bad day, make you feel pretty hopeless as well. So it's important to have this internal sense of therapeutic optimism, because sometimes the optimism you bring is the only optimism in the room. So if you can provide, as a clinician, this ongoing stable sense of optimism, you're going to be more successful with the population. The ability to employ diverse theories, concepts, models, and methods, to be flexible, culturally competent, to believe that all individuals have strengths and are capable of growth and development, and this recognition of the rights of clients with COD, including the right and need to understand their assessment results and their treatment plan. Some of the competencies needed for treatment. Perform a basic screening. We'll talk about this more in Module 3. Form a preliminary impression of the nature of the disorder, which can be verified by someone who's formally trained. It may be the case that you're not someone who can diagnose. It may be the case that you are. But if you are someone who can't diagnose, the ability to form a preliminary impression of what's going on and to provide that to someone who's formally trained can be very helpful. To conduct a preliminary screening on whether a person is an immediate danger to self or others. I touched on that. It's always foremost in my mind as a provider. Is this person at risk, and how can I be prepared to respond if they are? And be able to engage the client in a way to enhance and facilitate future interaction. De-escalate the emotional state of the person who's agitated, anxious, angry, or in a vulnerable emotional state. That's going to happen. So people will be having some pretty emotional days. Must know how to manage a crisis, including suicide or harm. This may involve seeking assistance from others. So even if you are someone who does not do crisis work, you will encounter people who are in crisis from time to time. So your crisis skills may be around how do you connect with someone who that person needs to meet with to resolve the crisis. Refer a client to the appropriate mental health or substance abuse treatment facility. Coordinate care. 6 areas of intermediate level competencies. I'll touch on a few of these as we go. I think we're we're winding down. So I know this particular module has been a lot of information, so bear with me. We're getting toward the end. We're going to cover 6 areas of intermediate level competencies and then touch on a slide on the advanced competencies as well. So integrated diagnosis of substance abuse and mental disorders is competency 1. This includes differential diagnosis, terminology, pharmacology, lab tests, and physical exam, withdrawal symptoms, cultural trauma, and self-awareness. Competency 2 would be assessment of treatment needs, severity assessment, lethality, motivation and readiness, appropriateness and treatment selection. And then competency 3 includes treatment planning. So you would be doing some goal setting and problem solving, treatment planning, documentation, confidentiality, legal, documenting issues for managed care providers. Now the next 3, competency 4 includes engagement and education, staff self-awareness, engagement, motivating, educating, early integration treatment methods. So this could include emergency and crisis intervention, knowledge and access to treatment, when and how to refer. And then finally, competency 6 is longer-term integrated treatment methods like group therapy, relapse prevention, case management, pharmacotherapy, etc. So now, getting toward the end, the advanced competencies would likely include diagnosing, so the ability to diagnose substance-related and mental health disorders, to comprehend the effects of level of functioning and the degree of disability and how to incorporate those into treatment, recognizing the classes of psychotropic medication that you might be encountering for substance use and mental health, use integrated models of assessment, intervention, and recovery, apply knowledge that relapse is not considered a failure, but as an opportunity for learning for all, treat relapses seriously, exploring ways of improving treatment to decrease frequency and duration. And then further advanced competencies include displaying patience, persistence, and optimism, collaboratively develop and implement a treatment plan, involve the family, the person, and other supports, and support quality improvement efforts, including incorporating consumer and family satisfaction, accurately reporting data, participating in the selection and use of quality monitoring, and attending to the needs of all staff to be respectful and collaborative. Accessing funding is, I think we're almost done here. Most successfully demonstrated joint funding, we've talked about that. Performance-based contracting can also be used, so expecting a higher rate when you can provide higher outcomes. If you're asking for a rate increase from your funding source, being able to demonstrate that you can provide better outcomes than another provider is very helpful in that discussion. Using evidence-based treatment and evaluation, pursuing federal grants, understanding the ins and outs of state funding, and also this tapping private funding through foundations if you can. Okay, that wraps up Module 2. So now would be the opportunity to take the quiz, and thank you very much.